So like the last time you were in here, we're going to test your strength first.
I had breast cancer and I had a lot of pain afterwards and a lot of range of motion issues, and that's what they're doing the study on, so I figured I would come and try to at least help somebody going through the same thing.
We're interested in understanding how different breast reconstruction surgeries affect the shoulder. It's a very common procedure for if you have a woman who has a breast cancer diagnosis to get a mastectomy, and they may like to restore the look and feel of natural breast tissue, and there's a variety of reconstructive options available to patients to do this.
I had a double mastectomy in 2015. I had reconstruction with just saline implants and a little bit of fat grafting.
We're looking at how these different reconstructions affect the shoulder and the muscles around the shoulder.
Loss of strength and loss of range of motion is what I deal with every day.
So today when the patient came in, the first thing we did was put surface electromyography electrodes on them. What these electrodes allow us to do is measure the muscle activity. Many of these surgeries involve the release of certain muscles around the shoulder, including the pec or the lat off of your back. And we're trying to understand how the combination of releasing these muscles could impact the shoulder and could impact, therefore, clinical decision making about which surgery should be offered to patients.
It's basically a big video game that they have me play.
We're measuring her strength as well as measuring the stiffness of her shoulder. So our next step is developing the ultrasound protocols where we can actually look individually at the muscles that are affected by these surgeries to see how they adapt. So we have this technology called ultrasound true elastography in the lab, where we are hoping to use that as a potential screening tool to understand how the pec changes and maybe be able to screen patients that are having larger percentage changes in their muscle stiffness over time to get them in the rehab that they need.
This is in 3-dimensional.
There's very, very few groups across the world that are actually looking at the functional consequences of breast cancer treatments on the shoulder. In particular, our biomechanical tools that we're using and our ultrasound tools are quite novel. We're probably the only group in the entire world that's performing this type of research.